Howdy, everyone. Matt here. I got a question for you. What do you think of physical therapists being primary care providers? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic of something from the physical therapy world. And this comes from this past summer from the House of Delegates over there in Washington, D.C. And they passed RC 1725, which is it's going to be the development of a primary care certification. And this has come out as people talking about physical therapists as primary care providers. Providers. That's a key word. And there's been people talking on both sides of it, giving your opinions of the cons, the drawbacks, the negative aspects, and people talking about the positives and the goods and all of that. And I wanted to talk about it, share my opinions and thoughts on it. And of course, I want to hear your opinions, beliefs, thoughts, all that down there in the comments below. Right off the bat, some of the more negative aspects I've seen out there, I've seen physicians talking about it. And a physician on social media is talking about, goes, I don't like this. What is it? Is physical therapists going to be diagnosing strep and flu with people? Are they going to be doing that with them out there? I'm going to say this. No. The point of this is not to step into what physicians do. It's not going outside of our scope of practice. So no, it's not diagnosing, strep and flu and cancers and those things. It's not doing those things. Another thing of speaking with diagnosing, I saw somebody posting online saying physical therapists are just terrible with diagnosing. The ones by me are just absolutely terrible. Now, the funny thing about that comment, when you looked over at the person, they said, well, I'm a chiropractor. Okay. I'm going to be honest. This is not all chiropractors, but if you spend 2 or 3 minutes on social media on the chiropractic side of, like TikTok or Instagram, you will see some wild diagnosis. Some wild. There's been some physicians talking about this, of showing, oh, look at this chiropractor. He's talking about, oh yeah, look at this x-ray here. See all of that right there? It's just their intestines full of poop in there. And they go, oh, you see all the inflammation, and that's causing all of their problems. And you need to get this, or, oh, you see this little slight curve? We got to get this thing, and we got to hook you up to these electrodes thing, and it's going to like recharge the body and push out the negative. Yeah, when I hear this chiropractor saying that PTs are bad at diagnosing, and there is a mountain of videos and evidence of chiropractors doing very wild things with diagnosing, that's a little crazy. Now, talking about diagnosing as well, I remember hearing this several years ago at a conference where a PT was talking about, they were working on getting direct access. And a comment that someone said, like, PTs, you cannot diagnose. You cannot diagnose people. And this PT said, I diagnose every single day. And the people were like, oh my gosh. He goes, yeah, I use CPT codes, don't I? Yeah, I diagnose every single day. Every single patient comes through, I diagnose them and assign them a CPT code for billing. Think about it. Think about what we do. Okay. We diagnose people. Okay. When they come in, you assess them, you evaluate them, and you come up with a diagnosis. Now, I understand. I'm going to be saying, well, the doctors should diagnose them. I'll tell you the last probably 3 diagnoses I've gotten on a prescription for physical therapy: back pain, knee pain, shoulder pain. So you just told me as a diagnosis, their back hurts, their shoulder hurts, their knee hurts. What is that? What in the world is that? Okay, that's knee hurt. What do you do for knee pain? What and exactly, and I say this to so many people, what is pain exactly? Pain is a symptom. A symptom of what? That is what we're going to figure out. That is what we are going to do to understand what is causing that pain. And I've likewise met physicians that don't really care about the diagnosis of like saying, this is what we found. They're going to do what they do and realize that they reached a point to say, oh, this is a musculoskeletal disorder, because I work in outpatient orthopedics. I'm going to send you to the PT. Let the PT do their thing. I trust that they're going to do the right thing. And so what we do, okay, cool. We're going to help the patient. We're going to treat them and work with them. And I would likewise say, how often with you in your practice, if you're a PT, or, OT or speech or what have you, that a diagnosis on a script has been incorrect. Okay. How often has it been incorrect? How many times have you gotten something like rotator cuff tendonitis, and that when you evaluated them, it is something completely different, or like a shoulder impingement? If that the whole discussion on that. How about something like piriformis syndrome? Oh, they got piriformis syndrome diagnosis. Or what was it? Plantar fasciitis is another. Oh, my foot hurts. Plantar fasciitis. That's it. There you go. Treat it. How accurate are those diagnoses? Okay. And again, and this is not to say that physicians do anything. It's not saying any of that. But we diagnose every single day. If you think PT should be primary care, hit that thumbs up button and subscribe to the channel. Back to the video. And lastly, the big thing I see from people within our own profession is that they're saying, this is bad. You're not helping the profession anyway. You're just going to charge more money. You're not going to get any more autonomy. You're just, you're paying all that money for school and whatever. You don't get paid more. And this is just Vision 2020 all over again. Here is the thing. This motion was to help develop a primary care certification. You don't have to do it if you don't want to. That needs to be kept in mind. When I've seen the people talking about that, that's the thing that comes to mind. If you don't want to do it, you don't have to do it. You have free will. You don't, there's nothing out there that says, oh, once you graduate PT school and you get your license, you have to be primary care. You have to see direct access. You have to see people who come to you who decide not to see a physician and be seen. You have to do that. No, you don't have to do that. As a medical provider, you can decide who you can or who you want to and who you don't want to see. Any provider can do that. The primary care down the road can choose who they decide to see and who they don't. You have that. That's it. That's the point of it. If you want to see them and you want to have the certification, you want to do that, you can do it. You can do it. You don't have to if you don't want to. Now, reading through the point of this, and you may be saying, well, Matt, what is the point? Okay. What is the point? And looking through some of the discussion, which is available for people to see on the APTA's website, the main thing of what they were wanting to do with this is just improve the abilities. So advancing the skill and efficiency and just being able to screen for issues. So think about when people come to you, that you're able to just kind of screen them to understand, are you someone that should be doing therapy? Okay. We're going to screen, hey, if something is not making sense, or maybe you have another comorbidity going on. So think about, with the jobs report that we're going to be getting into more rural areas and more people come to PT. You could be the first touch point of somebody coming in for healthcare, so that you can screen somebody and go, how long has your blood pressure been this high? Okay. So you're dealing with that. Have you seen a physician over that? Oh, you haven't. Let me refer you to someone to help get this under control. Okay. That's an ask. Do primary care physicians do that? Do other physicians do that? Yes. Screening to understand, is this something I see, or no. You have something else going on. Let me refer you to that provider who's going to provide you with the best care. Think about what the mental health aspect of it, behavioral mental health. That's an aspect of it as well. To screen for those things and say, okay, which we talk about again with musculoskeletal disorders, that people can have, there can be a psychological component to it. There can be have those other things of saying, recognizing, hey, there's something else going on. Let me refer you over to somebody. Let me talk to you about, I'm not treating you for those issues or the conditions. I'm not treating you for it. I'm recognizing them. I'm recognizing that there is something there that you need to go see this provider. And as someone once told me, someone who is absolutely amazing who taught me this, they said, all you need is a thimble full of knowledge. And all that is to just send them to someone who is going to provide them with the best care. Now, there was some aspects of helping like manage disorders and things, some health things. But again, not the diagnosis, but think about if somebody has, again, high blood pressure, diabetes, exercise and movement. Okay, hey, that's something that we're helping you monitor and just to keep an eye on it, to educate you better about those. Think of all the other things that we can do as physical therapists to help people. That is the ultimate goal of this. It's just improving to make it where you are a stronger provider to provide better care. And sometimes better care is knowing when to send someone to someone else. That's really the point of it. And again, if you don't want to do it, you don't have to do it. That's the point. That's another thing about it. You don't have to do it. But the people freaking out and saying there's all that, you don't have to pay for the test. You don't have to study for the test. You don't have to do it. If you want to practice and however that you want to practice, you have that ability to practice within the scope of practice. There. Anyway, with that being said, let me know your thoughts, opinions, beliefs, all that down there in the comments below. If you enjoyed the video, please hit that thumbs up button and subscribe to the channel. It doesn't cost you a copay or anything like that. And until next time, take care of your patients. Take care of yourself, Take care of your patients. I will see you then.